According to the CDC, meningitis is a disease caused by the inflammation of the protective membranes covering the brain and spinal cord known as the meninges. The inflammation is usually caused by an infection of the fluid surrounding the brain and spinal cord. Today I will be discussing 3 types of meningitis: bacterial meningitis, viral meningitis, and non-infectious meningitis, along with their signs and symptoms. The first type of meningitis I will discuss is bacterial meningitis. It's considered to be one of the most severe. According to the CDC, bacterial meningitis is usually severe. While most people with meningitis recover, it can cause serious complications such as brain damage, hearing loss, or learning disabilities. In the U.S., about 4,100 cases of bacterial meningitis were reported per year between 2003 and 2007. There were about 500 deaths reported per year as a result of bacterial meningitis between this time period. Causes of bacterial meningitis include Group B streptococcus, E. coli, Listeria monocytogenes, Streptococcus pneumonia, Neisseria meningitis, Haemophilus influenza type B. Bacterial meningitis can be transmitted through exchange of respiratory and throat secretions, by eating food contaminated with Listeria, in close or long contact with a sick person. Other meningitis-causing bacteria are not spread person to person but can cause disease because the person has certain risk factors, such as a weakened immune system or head trauma. Treatment for bacterial meningitis includes immediate strong antibiotic regimens. The best ways to prevent bacterial meningitis are vaccinations. The CDC says there are vaccinations for 3 types of bacteria that can cause meningitis: meningococcus, pneumococcus, and HIV. Antibiotics may be necessary for people who have been in close contact with an infected person. It's important to maintain certain health habits, including not smoking, getting plenty of rest, avoiding sick people, and frequent hand washing. The second type of meningitis that I will be discussing is viral meningitis. The CDC says viral meningitis is generally less severe and resolves without specific treatment. There are several causes of viral meningitis, including mumps, herpes virus, including Epstein-Barr virus, herpes simplex viruses, varicella-zoster viruses, which also cause chickenpox and shingles, measles, and influenza. Viruses spread through mosquitoes and other insects as well. These are called arboviruses. The CDC says viral meningitis can be transmitted from person to person through fecal contamination, which can occur when changing a diaper or using the toilet and not properly washing hands afterwards. Also through respiratory secretions such as saliva, sputum, or nasal mucus of an infected person. In contact with an infected person may increase your chance of becoming infected with the virus that made them sick. However, you will have a small chance of developing meningitis as a complication of the illness. Treatment for viral meningitis includes rest, fluids, and fever reducers. However, most people recover on their own within 7 to 10 days. The best ways to prevent viral meningitis are washing your hands, cleaning contaminated surfaces thoroughly, avoid sharing drinks, food, etc. when you are sick or with someone else who is sick, by getting a chickenpox vaccine and mumps vaccines, which are effective in preventing these types of viral meningitis, avoiding bites from mosquitoes and other insects that carry diseases that can infect humans, and controlling mice and rats. The last type of meningitis I will talk about is non-infectious meningitis. According to the CDC, some causes of non-infectious meningitis include cancers, lupus, certain drugs, head injuries, and brain surgery. Non-infectious meningitis is not spread from person to person. This type of meningitis is treated with cortisone medications. However, treatment may not be required because it can resolve on its own. There is no specific way to prevent this type of meningitis. I will now discuss the common signs and symptoms of meningitis. According to the Meningitis Research Foundation, meningitis means the swelling of the lining around the brain and spinal cord. According to the foundation, some common symptoms include fever, nausea, vomiting, severe headache, rash, stiff neck, fatigue, altered mental state, and seizures. In conclusion, I discussed 3 types of meningitis: bacterial meningitis caused by bacteria, viral meningitis caused by viruses, and non-infectious meningitis caused by certain infections, medications, or injuries. Some of the symptoms include headache, stiff neck, and high fever. There are many ways to treat these infections, but the best thing to do is to prevent them.